Okay. Thank you, everybody, for being part of our Fetal Health Foundation COVID Care Pregnancy During the Pandemic. My name is Lonnie Somers, and I am the founder and chair of the Fetal Health Foundation. This year has been a very interesting year, to say the least. I've seen some pretty interesting comics where I saw a kind of describe, and I thought it fits perfectly for how this year has been, is that first we have a bookcase of encyclopedias, and every year has got a encyclopedia except for 2020 has volume 1, 2, 3, 4, and 5. And then the other thing that I think kind of caught me kind of funny one time was there was this comic about, gee, you know, when I used to talk to my great-grandparents, my grandparents, and my mom and dad, and hear all the things that they went through growing up, going through the original Spanish flu pandemic, civil rights movement, the Great Depression, the Dust Bowl. I always thought what an interesting time to have to go through those things, but never ever thought it was all going to happen to us in one year. So that kind of sums up 2020 for sure. But you know, more than that is besides our medical heroes having to really come to the call for taking care of all those diagnosed with COVID and navigating everything that entails, it certainly, people haven't stopped getting cancer. And certainly in the Fetal Health Foundation side of it, people haven't stopped getting pregnant, and people haven't stopped getting complications. Those things are still happening. And whether you have a pregnancy that everything is going completely normal, or you have a pregnancy where there can be a high risk situation or complication, navigating this during the COVID time has added a whole new level of stress. And so we are here today to kind of let you know what from different experts that we have from our amazing panel on how we navigate all through that, and to be able to answer your questions and get their feedback from everything from just what to expect when you're delivering, what to expect in care, and so forth. So we're very excited to have a great group here today, and it's my pleasure to have Dr. Kenneth Moise, his wonderful wife Karen Moise, who's also been the coordinator, fetal coordinator for him at many of the centers that he's been on, and I think we're going on number 4 now, 4 or 5. I'm losing count. We are so great to have Jennifer Jones, RN, and she's a NICU nurse joining us, and Amanda Saunders, who is an expectant mom, and also working as an RN too. So she's got a really great focal point there. And of course, we have our executive director with us of the Fetal Health Foundation, Talitha McGinnis, who's going to be chatting with you and giving any questions up to us so that we can get them answered. I'd like to talk a little bit about the Fetal Health Foundation and what it is. We started actually in 2004, not even as a foundation. We started as a charity event to raise money and awareness around a certain fetal condition called twin-to-twin transfusion syndrome. And a couple years after that, we started realizing actually about after year 1 that there was really no organization for advocacy, research, support that was addressing all fetal syndrome issues that can happen. And obviously the experts that we have here today know that that's a pretty numerous number, even though some of these situations, when you take them in comparison to pregnancy each year, are rare. They add up to a pretty big number. In fact, so much so that according to the CDC, pregnancy complications that rise with fetal anomalies and syndromes account for 800,000 pregnancies every year. So that's a pretty big number. So the way that we got started in this as the founder, I am very blessed to have 2 wonderful daughters, Ashley and Aspen, who were diagnosed the 20th week of our pregnancy with twin-to-twin transfusion syndrome. When we were diagnosed, and this was our first pregnancy, we were diagnosed, we thought we were going to have the model pregnancy, and right away when we had that diagnosis, it really kind of ripped out the heart from us. It took us a while to conceive, and all I could think about is when we got that diagnosis that this syndrome was going to take away all my dreams and my hopes for my children and having a family. And that was taking away the first diaper change, taking away the first crawl, the first smile, the first steps, the first day of school, seeing them go to college, which actually both my daughters are going to be attending online college because their campus is closed. So we haven't quite become empty nesters yet, but this was again 17 years ago, and we were fortunate that as we were researching, like we all do, we all go out to the internet, start Googling information. We did the same thing, and a lot of the information coming up was very doom and gloom. But what stood out was a couple of doctors. We ended up a week later in Florida having a minimally invasive in utero surgery to save them, and we were successful at that point in time. That we had two baby girls born healthy. And through that experience, we realized again that more needed to be done. And that kind of started us down the path of creating an event, and that led into the Fetal Health Foundation, which we support many thousands of people yearly all over the world. And our biggest thing is that we just want to make sure that parents never have to come back and say, what if? What if I had known this? What if I had known that? We are there to provide the most factual information that we can and connect families with the medical experts that hopefully can provide them some hope and what type of options they have. Too many times we see that because really fetal surgery, although while it's been around for a couple of decades, it's relatively new, and it's a new field, and it's ever evolving, and the amazing things that they can do aren't necessarily widespread and known to your general OB or sometimes even a perinatologist. So awareness is so vitally important, which is why August is the National Fetal Syndrome Awareness Month. As part of our mission, we work closely with a lot of maternal fetal centers and physicians across the country, including a great medical advisory board that we have and our stewardship partners. The focus again of our National Awareness Month is to provide hope in a tangible way and shed a little light on families who receive fetal syndrome diagnosis. And during the National Fetal Syndrome Awareness Month, we showcase patient family stories. We share updates on research going on in the maternal fetal health community. We highlight what many of our fetal center partners are doing, which is some pretty incredible stuff to make a difference. And we look to gather support to continue making sure families are educated and receive treatment when a fetal diagnosis is given. The interesting thing about this month, and while we're not here today to make an active call for donating, but we do hope that you can find a way to support and can find a way to support the Fetal Health Foundation. One of the interesting things about fetal syndromes is it is very difficult getting people engaged around fundraising. And part of this there's a bit of a taboo situation that comes when people are dealing with pregnancy issues. We're not sure how to, as a society, to really handle it for mom and dad who are going through it, or mom and partner. When they go through something like this, the other thing that I think personally that makes it challenging is while mom has a really good personal connection with her baby in the womb, nobody else has a relationship with that baby. And so where you think about a sister, a mom, a grandma being diagnosed with cancer or other type of illness, everybody's known them their entire life, and people rally around that because they've known them, been part of their life, where a baby hasn't been. And so it's very difficult. There's still a lot of taboo around that. So that's what's so important about this awareness too, is getting it out there. And so fundraising tends to be very difficult. I can tell you from the Fetal Health Foundation standpoint, every dollar makes a huge difference. So there are ways on our foundation site at fetalhealthfoundation.org to donate. There's also ways right through Facebook to donate and support. So we hope you help us spread the word by sharing your story and thanking a provider or somebody that made a difference in your pregnancy. Certainly, please use the hashtag NFSAM or NFSA month. So with that, we are going to get started here. with our first group. Here we go. All right, so I am very honored to introduce to you Dr. Ken Moise. He's a member of the Fetal Health Foundation Medical Advisory Board and is a board certified in general obstetrics and gynecology, as well as a maternal fetal medicine specialist. He's the former co-director and current member of the Fetal Center at Memorial Hermann Texas Medical Center and professor in both departments of obstetrics, gynecology, and reproductive sciences in the Department of Pediatric Surgery at the University of Texas Medical School of Houston. He's helped create 3 fetal centers at UNC, the Children's Hospital in Texas, and Memorial Hermann, and now is going to be, hopefully not letting the cat out of the bag, is going to be setting up at, I believe, Dell Children's Hospital, a new fetal center that I believe is expected to open in April 2021.
Yeah, that's right.
We're also, we know that the power behind Dr. Moise is his wonderful wife, Karen, who I love the story. She has been the fetal coordinator for him at many of these centers, and then took a break to do one of her dreams, which is start a, if doing with fetal surgery in families wasn't enough, she decided to create a wedding venue and become a wedding coordinator. So then she has to deal with brides all the time, which I can't even imagine, Karen, right now, under the pandemic, what that's like.
Why do you think I'm rushing to get back to the hospital?
So Karen is going to be instrumental in certainly the new center. And one of the things I always say is that the fetal coordinator of these programs, and the reason that we have Karen on here today is because a lot of times the interaction that you have with a doctor is a very limited time. You have probably sometimes your most interaction with the fetal coordinator. And to me, when we went through it, the fetal coordinator almost became that surrogate parents to us. They're there holding your hand. They're there for a shoulder to cry on. They're there with you throughout the entire process. And so they take a lot of this to heart. They get really close to these patients. And so they are definitely a huge caring part of the entire process. She and Ken have been married for 35 wonderful years. And they have 3 amazing daughters, which I believe correct me if I'm wrong, did one of your daughters just get engaged or married?
Number 2 got married 2 years ago, actually at the wedding venue. Number 1 got married there 5 years ago. So we still have our caboose. I'm probably getting married there in the next few years as well.
That's
There
awesome.
were rumors that I built the venue for them, but it's not true, believe me.
I was going to say, was that a way to save money?
You know, I did tell them they were all going to get married there because it's a much cheaper wedding that way.
Exactly. So let's specifically go ahead and jump into this. Ken, you helped found 2 university-associated fetal centers, and you were honored in 2019 with a Lifetime Achievement Award from the Society of Maternal Fetal Medicine. Through all your years in fetal medicine, what do you think has been one of your biggest challenges?
That's a great question, Lonnie. I mean, I think you alluded to it a little bit earlier in that because we deal with an unborn patient and we call it a baby. Most of these moms have identified with their offspring through ultrasound. They've named their child. And I think it's hard because you can't see the entity. It's not like you said, a mom that's sick or a child that's sick with cancer. It's very difficult to get recognition in the fetal world for the fact that we're taking care of a child that's yet to be born. And it's not just for fundraising, it's even related to scheduling surgery. So if I'm trying to get into the operating room and I have pediatric surgeons who are taking care of children, I might get bumped because they don't think I have an emergency. And yet I look on ultrasound and find that these babies are quite sick and I need to get them to the operating room in a few hours. But because no one sees those babies but me through ultrasound, they don't understand the acuity of the situation. So I think recognizing the fetus as a patient has been the most difficult thing for the people around us. We recognize the unborn as a patient. I've even tried to secure medical record numbers for babies, and the lawyers have pushed back on that, so we can't get a medical record number for the baby. But it's probably the biggest challenge is trying to get people to understand that this is a human being that needs care acutely, and we need to deal with that.
Definitely. And you know, how, I know that you and Dr. Crumblehome wrote a paper that I think has since been published, kind of a white paper on some of the challenges that we're facing under COVID with high-risk care and some of these fetal centers. What has been some of those challenges?
Yeah, so COVID's put the entire medical community into a tailspin. And again, fetal surgery in many cases deals with a life-threatening situation, say, as in your case, twin transfusion. And then there are cases that are less life-threatening, like, say, meningomyelocele repair, spina bifida repair, where we're doing more of an elective type case. And so we've had to deal with those issues with COVID. Some of the centers closed down, particularly in the New York area during COVID. They just weren't taking care of fetal patients at all. They were sending them to other centers. Most of us stayed open, but we had to change the way we did things. All of our pregnant women and all of our surgeries do get COVID tested the day of surgery. And so we've had to, I just 2 weeks ago, operated on 2 asymptomatic COVID positive patients. And that requires a whole different use of the operating room and special equipment, special cleaning afterwards. But really, what our white paper said is we shouldn't deny patients, access to these surgeries, and we haven't. But we've had to take special precautions. And again, we culture everybody, and if someone's positive, they're treated a little differently. It also affects their support people. Many of the hospitals weren't allowing any guests in. We were able to get a waiver to let 1 support person in for the fetal surgical cases, but they had to stay in the hospital. They couldn't leave. If the patient was COVID positive, though, our hospital doesn't allow any support people. So that's very unfortunate for these patients because they have no support people at all. So there've been lots of challenges with COVID.
Kind of speaking into the COVID side of it, have we seen, I know everything is just kind of evolving right now, but have we seen any, if mom has COVID, are we seeing any transfer to baby in the womb?
Yeah, there's been a few cases where there's been a suggestion of transfer to a baby in the 3rd trimester, but the overwhelming information to date, even some basic science studies on the placenta, say that there are no receptors that can be found in the placenta for this particular virus, which is unique because viruses like Zika and cytomegalovirus or CMV have receptors in the placenta, and we know they do cross to the fetus. But a more recent paper suggested there aren't even receptors in the placenta for the coronavirus. So at least that's reassuring based on the data we have about babies and these receptor studies that probably the placenta is a good protector, if you would, of the fetus when it comes to coronavirus.
What does, currently if someone needs a treatment what's that going to look like for them right now?
Well, first things are going to look a little different in the ultrasound unit. Again, we've been able to get a waiver from a standard ultrasound unit, and we do allow 1 accompanying member to come in for the consult and the ultrasound. Everybody has to wear a mask, of course. Our sonographers actually have a plexiglass guard that they scan around to try to cut down their exposure a bit. And then like I said, when the patient goes to the hospital, they're going to be COVID tested. And if positive, we're going to still proceed with the surgery unless the mother's symptomatic. And that's a whole different cup of tea. If mom is positive and symptomatic, then we're going to have to reconsider when we do the surgery and what surgeries we might or might not do. Because obviously COVID infection in pregnancy with symptoms can be pretty significant. And so we don't want to put the mom at risk in that situation, particularly related to anesthesia risk that can be associated with these procedures.
Do we have any information if, just in general, not having a high-risk situation, but if we have a mother who is COVID positive, Do we have any information? Are they more likely to miscarry or deliver preterm?
So in general, we don't think that COVID is causing losses of babies, like I said, because it doesn't cross the placenta. But obviously, if the mother becomes very ill with COVID, sometimes we actually purposefully deliver a premature baby if mom is having severe respiratory symptoms. So our guideline right now is that if you're over 32 weeks and you're requiring a lot of oxygen because you have severe pulmonary disease from COVID, you're going to get sectioned. You're going to get delivered to try to help mom lose that oxygen requirement, if you would, for that unborn baby inside. If you would, iatrogenic prematurity is clearly more prevalent in patients who are symptomatic with COVID. For patients who are COVID positive but asymptomatic, they seem to do okay as far as carrying the pregnancy. They don't go into premature labor. But like any disease in pregnancy, when the mom gets sick, many times premature labor will occur because mom is trying to protect herself over the baby in that situation.
Kind of going off the COVID topic here for a second. Question I guess I would have for you, I think a lot of people, when they potentially have or diagnosed with a complication, what advice overall do you have to people when they're first diagnosed?
Are we talking about a fetal complication or maternal complication? Which are we referring to?
Fetal complication.
Yeah. So I think the best thing is to try to get educated, to try to learn as much as you can about that particular condition. There's a lot of good information on the internet. There's some not so good information. Obviously, your foundation provides some very good information. So get educated, do your homework. If you're not happy with the first place you go, seek a second opinion. Don't believe that everybody knows everything. Many of the more complex conditions, particularly the ones that involve fetal interventions, like the laser surgery your wife had, should be done at bigger centers that have lots of experience. And so you should be asking questions like, what are the outcomes at your center? How much experience have you had? Things of that sort. So it's to be an educated consumer, not only about the condition, but about the care that you might end up needing later on for treatment of that condition.
And now you alluded to, or we alluded to, that you are going to be building a new state-of-the-art medical fetal center at Dell Children's Medical Center in Central Texas in Austin. What made you decide to go ahead and start another center again?
Well, I think it was this woman right over here, because we've been living apart for the last 6 years, except for weekends. And so I've been commuting from Houston to Austin on weekends. Karen's been running the wedding business up here for that long. Dell Children's recruited a new chair of OBGYN, George McCombs from WashU. And George picked up the phone and said, you know, I have a fetal center at WashU. It's been a big success in St. Louis. And I think we need something like that here at Dell Medical School and Dell Children's here in Austin. And I agreed, and we've talked for a while, and it became pretty clear that the Ascension healthcare system, which is part of Dell Children's Hospital, is part of that, are very committed to make this a success in Central Texas. And other than there is Texas a big state. There are 2 centers in Houston, 1 center in Dallas, but nothing in the middle part of the state. So clearly the market is there and the need is there to provide state-of-the-art care. So I'm interested in setting that up for a few years and then hand the baton to some junior person I can find to run it with me.
I'd have to also add part of the thing with Austin. Austin, I mean, it's the state capital of Texas, and it is really this little nugget, this little unpolished gem that we have here, and it really is centrally located in Texas. So it's really going to provide, I feel like, a safe atmosphere, a safe environment for couples and families to travel to Austin versus the big cities, big scary cities and highways and spaghetti, you know, parking lots that we have in Dallas and Houston. So it's really going to fill a void for, you know, premium state-of-the-art fetal and, you know, maternal care to the moms that would probably, I feel like sometimes not even bother going into Dallas or Houston because they're too afraid. So it makes it safe. Plus, we've had tremendous growth of younger population in Austin, and still today with COVID growing, we have 150 new people moving to the Austin area every day. So there's a huge population growth when it comes to actually population growth, and then, you know, complications that kind of like become associated with those. So I think it's really gonna fill a huge void that we have for the western as well as north and south part of the state, instead of having to go into the big scary medical center. And it's still a medical center, but it's a little bit, kind of feels more what they're used to or what they're accustomed to at home.
Yeah, definitely. So, Karen, give us a little bit, maybe question of, or, you know, with, well, obviously, I think when people start going through or diagnosed with something, you know, they're with their OB, then they get to a perinatologist. This is no disrespect to perinatologists, but I feel like sometimes they can be very dry, and you kind of start getting a little bit nervous of care. And then next thing you know, you're going to be traveling to see Dr. Moise and his team, and it seems like you're going up in level of care, and it can be intimidating to families. I think the experience is completely opposite, where it's such a caring and consoling environment. But what would you want to tell families if they have to go through something like this? What to know, and especially what does your role play?
I think the first thing is that they can contact us right away, and we're pretty much on call 24/7, and they can get a hold of us. And through the years of experience, pretty much I can kind of like sometimes even diagnose them over the phone based on the symptoms that they've given. And not to be disrespectful to any perinatologist, but there are, again, different levels of perinatologists. And I have great relationships with perinatologists that many times will actually call me first and kind of like run the patient history before they want to talk to Ken. So it's kind of like they want to sound like they know what they're talking about or a little bit more educated. And so I'll talk to them first, and then they go, okay, now I can talk to Ken now. So that's kind of like been a really fun, they still text me and call me even today, and I'll have to go, hey, can you call this doctor in Dallas? He's texting, he needs help with the patient. But just that familiar voice, you know, so many times when you get pregnant, you rely on your girlfriends or your, you know, other family members, and occasionally your mom to reach out to help you navigate that pregnancy pathway. But then let something like kind of throw a little roadblock in there, that's a baby with a life-limiting condition or an anomaly that's going to either need treatment, or even not even in utero treatment, even that especially high advanced care afterwards. They're needing to have that information. It's very fear driven. And I have this mnemonic for fear that truly fear does appear real, but there's no real true threat of immediate danger. So it's the fear of the unknown that causes their fear level to actually increase. And so if we can talk them through the actual situation, then their fear goes down. So we basically transfer fear with knowledge, and that knowledge is very powerful to help them kind of like pull them down off the, you know, chandelier, or, you know, kind of back down to earth, and that they know that there's a comfort level with us and our center, that we're here to help them. And like I said, 24/7, any questions or concerns that come up. And I'm a big Facebooker, and I usually tell all my patients to Facebook me. So I'll even watch them on Facebook, and sometimes they'll start complaining of symptoms to their family and friends, and I'm going, oh, no, no, no. And I'll immediately like reach out to them and going, you need to get to the hospital right now. So it's crazy how social media has actually helped up our game when it comes to patient care.
Yeah, exactly. And I think that's also, you know, when we found with the foundation starting, it was always about trying to combat misinformation on the internet. And then social media came into play, and there's some very wonderful groups that are trying to help support, but everyone has experiences differently and so forth. So I think for me, it's always been the message of these support groups are great, but make sure that you align with either a foundation like ours or a medical expert that, you know, not there to give medical advice, but make sure information is being given that's appropriate and not being misled to be medical factual information, because we've obviously seen that through, I think when we were researching TTTS when we got diagnosed, I think it was everything from, the magic elixir drink that would cure you to, to a majorly invasive fetal surgery that would put my wife's life at risk. So it was, what's real and what's true. So that's always a big important thing. Karen, I'm really curious as to why you want to get back into this world again.
Well, to be perfectly honest, with the exception of the very first fetal center that we started at UNC, I've actually been the advanced team and have gone in and started all the fetal centers, usually 2 to 3 months in advance, to get the team up and running and cohesive. And then, Ken would come in and we would usually be doing surgery like the next day. It is probably one of the most rewarding experiences I've ever done. And for some reason, Ken and I collectively have become creators. We love creating, we love educating, we love teaching, but we also love passing the torch. And so that's important to us, that we build a state-of-the-art, fetal center here, in Austin, and then we can get, Austin up and running. And then, like Ken said earlier, it'll be time for us to retire. He's starting his last circle around at retirement age, and I'm not too far behind him, but we just love being a part of this, and it's so incredibly rewarding. And like I said, I do own a wedding venue. We do between 80 and 100 weddings a year, and there's a big difference between the bride that's so unhappy because her pink napkins are the wrong shade of pink, and I want to look at her and going, there are babies dying all across this world that have, life-limiting conditions. And that's what's really should be, what we're worried about and what we're concerned about. So it's kind of helped me with them to kind of put things back in perspective as to really a napkin versus a baby that you're going to have fetal surgery on. So that's kind of like led me back to my happy place.
It's wonderful, and I think this being part of the Fetal Health Foundation and now having the fetal therapy think tank as part of everything, and the leadership that Ken and others have brought to that program has been pretty incredible and eye-opening for me. Is the amount of thought and work that goes into a fetal center. Everything from your standard OR size typically isn't big enough for what needs to be done with fetal surgery, and all the variations, because you have mom and baby are essentially patient, and all those things speak to, I believe you kind of have a clean slate with the center. So speak to some of the things, maybe real briefly, that you're looking forward to in developing this new center.
Okay, yep.
Well, I think what's interesting about this new concept here in Austin is that I think we've finally learned that we shouldn't be separating mothers and babies. And so often the freestanding children's hospitals have given great care to children. But as we move into fetal medicine, they've struggled with how do we bring that unborn patient into the system. Moms don't want to be separated, nor should they be separated from their offspring. They want to be there when that child goes to surgery later. And they want to talk to their surgeons and get progress from their nurses. So what Dell Children's is going to do, which is a model that's at Colorado Children's, it's first started at Children's Hospital of Philadelphia, is to build an OB unit within the Children's Hospital, a small unit for low-risk moms, but moms with baby problems, so that they can deliver at the Children's Hospital and be, one floor above the NICU and not be separated. It's just, children's hospitals are so often freestanding buildings that we need to change that paradigm, and many are beginning to do that, including Dell Children's, to address that need. And I think that's going to be the future. In fact, I believe the future of this is not just a unit, but a whole maternity hospital adjacent to the children's hospital, because they go hand in hand, right? And the idea of putting a maternity hospital in an adult hospital, having worked at children's hospitals and worked at adult hospitals where I work now, it's a very different paradigm. You get a lot more clout when you're in a women's hospital or a children's hospital than you do when you're overseen by the trauma service or the cardiovascular service or the neurosciences service that bring most of the revenue into one of those main adult hospitals. So this is probably, I think, the most attractive thing to what Dell Children's is planning, is to have that maternity unit inside of their building where moms can deliver there. We will do all of our fetal surgery there, but we'll also take care of the moms who, as Karen said, have babies with life-limiting conditions or other anomalies that are going to need surgery after birth. They'll deliver there also and be next to their baby, and I think they'll get great care. So that's what's exciting about it.
Definitely. Yeah, it will be pretty amazing facility to see for sure. Well, thank you both very much. I certainly want to keep you guys on. We're going to have some questions at the end, but we're going to switch over and talk to a wonderful Amanda and Jennifer. So I'm going to hopefully get you unmuted here, and I apologize to some of our viewers that we had a little bit of a technical difficulty at the beginning, but the good thing is it's recorded, so we'll be posting the whole thing out on Facebook right afterwards. But we are joined by Jennifer Jones, is a clinical nurse 3 at Levine's Children's Hospital in Charlotte, North Carolina, and has worked in the neonatal progressive care nursery for 19 years. She serves as a charge nurse for her unit and has served on various committees, including Primary Nurse Committee and the Neonatal Infant Feeding Therapy Committee. She is married with 2 children and lives in the greater Charlotte area, North Carolina. So thank you, Jennifer, for being with us today. And also we want to welcome Amanda Saunders, and is our expectant mom and nurse. She and her husband Ryan live in Concord, where she works at the ICU as an RN at Atrium Cabarrus. Did I say that correctly?
Yes, sir.
Please don't call me sir. I feel old if you do that. And Amanda and Ryan recently sadly lost a baby at 18 weeks along to a chromosomal abnormality, specifically cystic hygroma, where there is a fluid-filled sac that results from a blockage in the lymphatic system. So very sorry to hear about that. But thank you both for being here. Amanda, you are in your first trimester. We were in first trimester when COVID hit. What were your initial thoughts?
Well, as you mentioned, that we had previously lost a child at 18 weeks. So initially, it was prior to North Carolina being on lockdown. It was very early in all the COVID. We were very intentional about trying to get pregnant. So we knew very early on. So honestly, COVID was not really on my radar initially when we found out we were pregnant. But having a healthy baby was ultimately what was. So it wasn't until probably several weeks in that that COVID became a little more something to worry about.
Definitely, and I can only imagine. First of all, being pregnant during COVID and an ICU nurse. How has essentially? I'm kind of incredulous on how have you been dealing with that. I mean, that's a lot to take in on trying to obviously protect yourself and the baby, but at the same time helping the most critical patients during this pandemic.
Absolutely. So it has been very challenging. Clearly, as an expectant mom, I am not taking care of COVID patients, nor am I taking care of patients that are being tested, or as we call them, being ruled out for COVID. So not only do you have certain things that a pregnant nurse can't take care of, but now we have COVID on top of that. So I've been very fortunate to work with a group of colleagues, and my manager's been great. So, but it is getting a little more challenging, just simply for the fact that our hospital is one of, within our region, we see a lot of the COVID patients. So our ICU unit is being very much saturated with that. So there may come a time during my pregnancy where they have to find a new home for me. So, but as of right now, still at the bedside, still trying to do the best I can and wearing all the proper precautions. We, here in ICU, we change daily when we come in and before we go home, constantly wearing my N95 along with my surgical mask to cover that. And then eye protection as well. Eye protection, as everyone knows, has been very big with the COVID pandemic and protecting expectant moms and and everyone really. So all the things.
Definitely. Give us a little bit of, being pregnant during this time, how has things changed with your appointments and medicine and your follow-ups and so forth like that? And then, even take us to the thought of, have you come up with, because obviously COVID isn't going away anytime soon. So, when you get to labor, have you done like a pre-labor delivery plan or any of that type of stuff? How's that all changed for you?
I actually went ahead and kind of pre-warned my husband, because again, we're due in November, because I am a high-risk pregnancy because of the loss of our daughter before, and because of my advanced maternal age. For multiple reasons, they do not want me going full term. So we will probably deliver mid to late November. My official due date is November the 28th, but we know that I will probably have to deliver before then. And I've went ahead and kind of pre-warned him to be prepared to fly solo. During flu season and COVID, I don't anticipate that they will let anyone other than, he and I in there. And that's something that mentally we're prepared for. I'm good with. I think I may be a little more good with than he is. He's a little more nervous, but as far as appointments, unfortunately, he has not been able to be present for any of the ultrasounds. When appointments that I've had at the maternal fetal medicine here locally where I'm a patient, he has not been allowed to go at all. So we have tried to make the best of it, and we just FaceTime so that he can see in real time the ultrasounds. He has recently been allowed to accompany me to my regular OB checkups. So that we've been very thankful for, but unfortunately he has not been present for any of the ultrasounds. And that's a little bit of a bummer, especially, for as we progress, because my ultrasounds previously, we never got good news. So you can imagine the first time I was at the high risk office for that ultrasound, it was just lots of nerves. So.
Yeah, absolutely. And have any of your appointments been kind of just telemedicine, or has it all been in person?
I haven't had any telemedicine. I found it to be very humorous that the very first appointment was via telephone. I wasn't really sure how they were going to do that. I didn't know if it was going to be virtual and they would see, like we would be able to see face to face, or if it was just an audio appointment. And indeed it was just an audio appointment. So we kind of joked that, if it would have been virtual, I was just like, what are they going to have me do? Like show them my pregnancy stick via Zoom. So it's been interesting, but very quickly they got us in the office and we were able to proceed. Yeah,
I think the smartphones are great, but I don't think they can do ultrasounds yet. So that can be a little challenging. What advice would you give people right now that are pregnant, and to calm their nerves, and I guess actually even what to expect? Obviously we talked a little about the appointments and things like that, but really even if they're getting ready to deliver.
I think the biggest thing is to educate yourself and not always take other people's word at face value. Just do your research. Do everything you can to protect yourself as a new mom. If that means we have to be our best advocate for ourselves. And if that means, not being around some of our friends and family, because we can only control who we're around, what we're doing, and we can't control where others have been and what they participate in. I am working, however, other social events and things, we have very much social distance. We have limited what we've done. My husband doesn't like it when I go to the grocery store. So it can be very frustrating as a very independent person to kind of relinquish some of that and let other people do things for you. But again, you just have to, what I keep reminding myself is that why take an unnecessary risk if it's something that you don't have to do? You don't have to go to the mall. You don't have to be around these people or go to these places. Even simple things as church. My family has preferred that I'm not back in a church setting where people are choosing not to wear masks and be protected. So we've been fortunate that our church does online services, so I've been able to still be involved, but just really doing everything I can to protect myself and the little nugget. Poor thing doesn't have a name, but yes.
Well, we wish you all the best of luck. Thank you for being part of this today. I don't know what your time frame is, but if you were able to stick around for any questions, that would be great. If not, we totally understand that you're busy, but we hope that you please let us know how you're doing and how things go, and hopefully you have that wonderful Thanksgiving baby.
Absolutely. Thank you.
Jennifer, we all know, thank you for being part of this with us today. And we all know that the NICU is for the tiniest and often sickest of babies. When the pandemic hit, what was the general feeling from the nurses in your unit, and what type of things did you guys have to adjust?
Well, initially there, of course, was concern and just not really sure how we were going to handle the challenges that lied ahead with our visitation policies, with our babies, how we were going to handle all the things that go along with taking care of premature infants. We were very fortunate. Our Incident Command Center was set up for 24/7 availability. They held teammate calls daily. We had updates via email, via our Halo phones. And as far as the neonatal team, they did daily updates with the leadership team, with our infectious disease physician, so that as nurses could feel confident in how things progressed and what we could do to protect our neonates.
What would you tell parents right now that might be, obviously sometimes people know they're going to have babies in the NICU, sometimes they do, but what would you tell parents right now what to expect? And I'm sure it's a nerve-wracking situation, because I feel like the media's made hospitals, obviously it's where they're taking care of COVID patients, so it's kind of like everybody else wants to stay away from a hospital. So, and it's providing obviously some anxiety and nervousness around families.
Yes, it does. I think the biggest thing is if our moms are inpatient, they receive, and we know they're going to deliver prematurely, especially, or have a baby that has complications and that will need neonatal care. We have neonatal consults. So our neonatologist goes and speaks with the parents along with the neonatal navigator, family navigator, and they're a huge part of our team as far as educating parents and giving them resources. So initially it's just the education of what to expect with having a premature baby, along with the pandemic. And this kind of leads into the third question I think you were going to ask, is things that we've done differently. Our unit has a screening tool initially before pre-pandemic that we screen all of our parents or visitors, because at that time we had multiple visitors coming in. So we've already had things in place that we just were able to amplify once COVID came along. So just giving the parents the heads up of how the flow of the unit would work.
Definitely. And, I think in general, just even outside of COVID timeframe, NICU can seem like a scary place to families. And we certainly know that as this is being recorded today, we hope it's a informational source for many years to come for people. And one of those things is just in general, obviously things are different with NICUs right now, but in general, if we can think about maybe a time in the future when maybe things get to some type of normalcy, is what type of things what would advice or information would you give to families if they have to deal with having a baby in the NICU? I mean, it always seems like a very scary place. And it seems that, you have all these very fragile babies. And what type of advice would you give them, or reassurance?
In general, we're doing everything we can on a normal basis to keep our babies safe and free from becoming sick or exposed to anything from the outside world. We scrub, we change into greens, we wear our mask, our goggles, all these things. And I think we were already very on top of the screening process. We have limited visitors, so that's a big thing for families, not having that support to come in, just like Amanda spoke to. Right now, the only people that can visit a bedside are the mom and her support person, whether that be the father of the baby, an aunt, a grandparent, but it's only one other additional visitor. And that's very hard, especially, when you have larger families that want to come in and support, it's very challenging. So I think just having some patience, making sure that you're still doing some self-care and self-help, finding a way to decompress, reduce your stress, all those things will help when you have a baby in the NICU setting.
Well, thank you so much for all this. This has been great to have your expertise, and we actually have some questions coming in, so I'm gonna ask everyone to unmute if they would, and see if I do this correctly. The first question that we have that came into is from Tessa, is curious to know what are some of the best practices for having visitors once bringing baby home from the hospital. So obviously everybody wants to come and see the brand new baby and stuff. So what should the family be doing to protect themselves and the baby? Who wants to?
I'll speak to that. I think that we tell moms on a regular basis to make sure that when visitors are coming, that they haven't been sick, that they haven't been exposed to anyone that's sick, washing your hands, good hand hygiene. I think now you just have to amplify that. And obviously we're all trying to social distance. We're recommending that, but just as Amanda spoke, you don't know what everybody else is doing and what kind of guidelines are they following. So I think during this time, it's even more important that you're very vigilant as a parent of who comes around, and making sure, that you're staying healthy as well.
I just want to throw in a little bit of that because I have a brand new grandson that I've only seen once when he was born, and he's like 8 months old right now. And I say Zoom calls, set up a family Zoom call, because we are dying as grandparents and as family and friends to be able to see those babies. And I, would love to be able to go there, and we're pretty much quarantined here, but I'd say regular Zoom calls, so that way they can feel like they're part of that, because I don't think this is going away anytime soon. So it would be really hard for me as a nurse, especially a NICU nurse, or any baby that has any life-limiting conditions or anything that's going to actually put them at risk, to let anybody in my house. I might not even would let my husband hold my baby.
No, thank you for that. And I think I think one of the challenges right now, and certainly anyone correct me if I'm wrong, but I feel that we've been hit with this pandemic of COVID-19, and there's so much yet we don't know what the effects are of it. We don't know if just because if you have COVID, if you are completely immune from any type of flare-up happening in the future, something like I think described, we don't know if it could be something like chickenpox, that once you have that virus, you may not get chickenpox, but you get shingles later in life, and we don't know what type of if it's causing any type of damage health-wise to people long-term. So I think I think it's really easy for us because we're so immediate. We want to get back to everything as quickly as possible to normalcy. But I think, like Karen said, that having Zoom calls and being as safe as possible is very important, because we just don't know yet. We're learning. We're trying to study this virus at the same time as it's hitting everybody, and there's so much left to be learned. We have a question from Lisa directly to Amanda. She asked, even though it looks like you might deliver early, has bed rest been recommended to you at some point before delivery time?
No, and thank goodness, because I would not do well with that. I'm a very active person. I did, however, because I am still working and I don't know what that's going to look like down the road, I have asked my OBGYN if he recommends quarantining prior to delivery. Fortunately, I have enough PTO that is something that I could do if need be when that time comes. So I can take a week off and just really be on lockdown at home prior to delivery if needed. But thank goodness, as of right now, and Lord willing, no bed rest in sight.
That's great.
Well,
Lonnie, maybe can I speak to bed rest? I think historically, as OBGYNs and MFMs, we have prescribed bed rests profusely for a variety of conditions. And I think as more and more evidence comes out, it really doesn't change the outcome of the pregnancy, hardly at all. What it does do is create a psychological nightmare for that patient who's now not active anymore, not being able to do the things they normally do. There was actually a study done in Scandinavia on twins where they put them at bed rest, and actually they had a higher rate of preterm delivery because of the stress of being in the hospital at bed rest than being allowed to have normal activity. So I think bed rest is overprescribed without a lot of data to say it makes any difference at all in the pregnancy. So I personally, in my practice, very limited prescription for bed rest, even with severe twin-twin transfusion. I don't know that it makes any difference in the outcome.
No, that's definitely very interesting. Thank you for that. We have a question from Michelle to Amanda and Jennifer. Is pregnant moms typically have classes like childbirth and breastfeeding classes. With all the social distancing, what options are for expectant moms right now? And probably to add on to that, a follow-up question I have on that is, with breastfeeding, is there any concern that the virus can live in breast milk and be transferred to the baby?
So yeah, I can take that question. So there isn't any data right now that the virus is transmitted in breast milk. At our institution, we allow the moms to breastfeed. We prefer they wear a mask and do good hand washing beforehand, but we still let them breastfeed their child.
And then,
as far as our classes at the NICU, we still offer classes. We limit the size of our classes, of course, for social distancing purposes, but we are set up to do all of our teaching at the bedside as well. So that's not really affected us, and we still are encouraging, of course, breastfeeding at this point as well.
Oh, that's good to hear. And here's actually kind of interesting one is we're all being told to use hand sanitizer like crazy. Is that safe when handling your baby?
Wash your hands.
We use plenty of hand sanitizer in the NICU between patient care, along with good old soap and water, but we have not found that that causes any issues. We've been using hand sanitizer for years.
Great. Awesome. Talitha, do we have any other questions out there? Nope. Okay. Well, I want to be appreciative of everyone's time and your valuable time. And thank you so much for being part of this. And I appreciate the dealing with a couple of glitches, but this has been invaluable. And we want to thank you guys so much. We especially thank Dr. Moise and Karen, Moise, Jennifer Jones, and Amanda Saunders for sharing your expertise and your experiences. I think what this also really does is it helps us put that you guys are real humans. You're not these scary medical people and stuff, that you are very compassionate and caring, and we appreciate the work that you guys do. And I know that from everything that you do is that you take a lot of this home with you. A lot of times you're supposed to leave your jobs at the door when you leave, but I know you guys take this home, and just being involved as much as I have been, I know that you guys sometimes will stay awake late at night thinking of ways to help a family or a patient and so forth. So you are truly our heroes. And so thank you so much for everything that you guys do. Again, pregnancy at any time can certainly be a challenge. at times, and through a pandemic, it certainly has highlighted the anxiety and expectant parents feel. So it's been wonderful to have this chance to talk with you and get some facts and some reassurance to everybody. Reminder that Fetal Health Foundation is here for you. We are here to provide support, resources, and hope to expectant parents, particularly those that have complicated pregnancy diagnoses, but we are here for any situation. We have a wonderful team of experts that we can always get information, get answers to your questions, and we're there to be a resource for you. Please make sure that you visit our website. It's fetalhealthfoundation.org, or you can also type fetalhope.org. We've posted a series of resources for both expectant and new parents about COVID-19, and we'll continually update those as more information becomes readily available. And you'll also find information about the various fetal syndromes, blog posts from parents who have experienced a fetal syndrome, and a listing of all of maternal fetal centers across the country and much more that provide resources available. You can always contact us, very easy to go under the Contact Us tab, and you can also, we encourage you to sign up for our e-newsletter to get the latest information from the fetal medicine community. And just a reminder that help us with awareness, even if you just do a small post with a picture out there that August is National Fetal Syndrome Awareness Month. That awareness is so vitally important. To break it down, that fetal syndromes affect more people per year than breast cancer. And we know the amount of breast cancer awareness that is out there. So certainly not to take anything away from breast cancer, but we need more awareness out there, because we can do so much if we get more awareness out there and being able to get early intervention when it's possible. We encourage you to certainly please help us with that awareness, and please use hashtag NFSAM or NFSA in month. You can also, we certainly encourage you can create a Facebook fundraising page or make a donation to the Fetal Health Foundation at our website at fetalhealthfoundation.org. This all helps to provide families in need with travel and other assistance so they can see specialists and receive treatment and hope and that continued awareness. And I know we're really excited as we've announced that this consortium of a fetal therapy think tank is now part of the Fetal Health Foundation, a program where we have some of the most amazing stakeholders and researchers and doctors all involved working on solutions to keep fetal medicine going, to keep it improving, with really the true thing is to improve outcomes. There's, I think, I can't remember who told me one time, but while surgeons love to do surgery, surgery is always a last resort type of situation. And you never want to do surgery unless it's going to help improve the outcomes. And so it's amazing the things that they've been able to do. And so thank you again to everybody for being here with us for our first ever Fetal Health Foundation live Facebook. We will be continuing these as part of during the pandemic to get information out there too, and probably continue and post that, because I think it's a great medium for getting information. So again, thank you to everybody for being here today. I wish you all the best. Please keep in contact with us. We'll see you next time.
Thanks, everybody.
Thank you.
Thank you.
Thank you.